I am absolutely thrilled at the potential that this has. PPMC there's lots going on the campus right now. There's orthopedics, there's cardiac, there's ophthalmology. However, and this is my bias, I think trauma really is a different entity. Being a regional trauma center is a tremendous opportunity to take care of everything and everybody. The word no is not an option.
All of us are very, very excited about the opportunities that the Acute Care Pavilion at the Presbyterian Medical Center are going to provide. The ability to take someone who is bleeding to death and needs an operation in literally a matter of minutes and commence surgery is by definition what a trauma center is.
The most important part for the trauma patient are the multiple departments that they'll see, and with the trauma team, we're all one group. So they go in through the emergency department, they see the trauma surgeon, and they work their way up through the system. The benefits to going to a Presbyterian is that all of that will be in one tower, that we'll be able to go right up in an elevator from the emergency department, the trauma bay, to the operating room, to the patient care. So it's all one area that we're traveling through to make it more convenient and make it better access for the patients.
We've been able to bring our clinicians directly into the planning process for the construction. And what that's done is allow their experience and their expertise to inform how their working environment's designed. Their input has guided the design of the clinical care areas, as well as how we'll use technology.
In the new unit, we'll bring together 20 beds of combined medical and cardiac surgical patients. So the teams of cardiothoracic surgeons, critical care anesthesia, cardiologists, and critical care nurses will work in one unit together to develop new, innovative ways to care for patients with critical cardiac illnesses, perform collaborative research together, perform teaching in a collaborative atmosphere between medical and surgical specialties. So it's a really major move forward in the way we care for patients.
Brain injuries are the leading cause of death in trauma patients. And so having a neurosurgeon as part of the trauma team is essential. Having the neurosurgical program there and operating in the same way that the trauma program does helps us with taking care of the other patients who are at Penn Presbyterian who need neurosurgical care outside of the trauma program.
We're particularly excited about the expanded emergency department, the new trauma bay, which will allow us to take care of 5 patients simultaneously, the 2 new surgical intensive care units, and the expanded operating room capacity.
A trauma surgical intensive care unit is a 24/7, 365 unit. There are the same level of excitement and activity that you see at 9 in the morning, you see at 9 at night, you see at 3 in the morning, because of the types of patients that are coming in and the 24/7 level of physician coverage that you have. It really creates an exciting environment to work and delivers really the best care for the surgical patient.
From my perspective, everything, any injury, trauma, fracture, motor vehicle, fall from height should come to this level 1 advanced care trauma center that really is going to be the best in the region.
We have an opportunity to really enhance what we do, especially for our pre-hospital providers. Putting places in the trauma bay where the pre-hospital providers bring the patients in, can stand, watch the resuscitation, participate, give us feedback. Continuity of care and the information they provide and the treatment they provide before they get to us is critical. And having that interchange, not just for a split second as they hand the patient off, but having it at bedside throughout that transition of care.
The biggest benefit is going to be involving the physicians early on in the process, specifically in the triage process, where patients will be identified early on and moved from the waiting room, from the triage area, to different areas of the ER. Sicker patients are going to be treated more promptly and seen faster by their treating team.
The nurses were completely involved with the development of the entire perioperative area, and the best part is the holding area and the post-anesthesia care unit, because it's now one big unit and it flows naturally for the patient.
It's going to bring a whole group of patients they don't presently have, all the trauma patients. As a result, the other services, orthopedics, neurosurgery, critical care, and neurocritical care, neurology, are all going to have enhanced presences. And each of these services is going to have its own patient base. So I think we'll see a big change in that hospital.
So it will bring trauma with 24/7 in-house anesthesia and critical care physicians and trauma physicians. It'll bring neurosurgery, much higher intensity lab facilities.
Think of this expansion of our capacity as a service to our communities.
And so we're actually getting to take something from the ground up, which is which is challenging, but it's a tremendous opportunity for us.
We all find it a very exciting time for Penn Presbyterian, and we believe that will open a new era in the history of Penn Presbyterian Medical Center.